most famous physical therapist on the internet.
Hi there, folks. I'm Bob Schrupp, physical therapist.
Brad Henning, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
I was trying to throw Brad off.
Change of life in that high pitch there.
Yeah. Okay, today we're going to talk about knee pain. This is the single best strengthening exercise you can do. No equipment needed. Mm-hmm. This is according to research, actually extensive research.
Sure.
So, by the way, if you're new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, go to bobandbrad.com. We're always doing a giveaway.
Yes.
Go to the giveaway section. We're giving away a mattress.
You bet.
I'll talk about it in just a minute. But you can also go to Facebook. A contest will be pinned to the top of the page. Go to Twitter, Instagram, or TikTok if you want a 60-second version of our program. We're giving away the Sleepovation mattress. This is just a small sample of one.
Right.
It's bigger than you can order all the sizes, king, queen. Twin, is that one?
I never can figure those out.
Yeah.
But anyways, it's bigger than this.
So 700 individual mattresses each one has, and it really conforms to your body. Really the most comfortable mattress Brad and I have tried, I would say, in our lifetimes.
Not together.
Not together. I knew you wanted to.
So anyways, yeah, and they come with a really nice fitted
cover.
Yeah, they're top of the line. I'm very happy.
All right, I'm going to get this off to the side.
Let's get to knee pain, Bob. Knee strengthening.
All right. If you're going to only do one strengthening exercise for your knee pain, make sure this is it.
Yeah.
Because, again.
Yeah, this is pretty interesting to me because it's nice to narrow down and be efficient with what you're doing and doing the right thing.
Right. Because I think Brad and I have both found that with our patients over the 100 years that we practiced, they tend not to follow our instructions a lot of times. And the only time I have luck is I tell them, you're going to do this one exercise.
Yeah.
I don't care what else you do, but you're going to do this one.
I just worked with someone. He said his previous PT gave him 10 exercises for his back pain.
And he didn't do it.
No, he said some of them hurt. And I said, well, we're just going to do this one. So we're working with him right now on that. So anyways, carry on.
All right. So there's lots of muscles around the knee. We'll mention some of them. Sartorius, gracilis, adductor magnus longus. I'm reading them all.
You've been doing your homework, Bob.
The quads is actually 4 muscles. The hamstrings is actually 3 muscles. Even the gastrocnemius and the popliteus go across the knee too.
I always forget about the popliteus.
Yeah. So I got this from Jim Johnson, physical therapist, who's written several self-help books, including one on the knee, and he's done the research.
Yeah.
So the research shows the same muscles around the knee respond to knee injury, pain, and swelling by getting weaker, smaller, or shutting down. It seems to be the same ones over and over again.
Which are the quadriceps?
The quadriceps, yep. So like with knee swelling, they found that knee injuries, ligament problems like the ACL or PCL.
So you're saying the quadriceps, as a result of these injuries, they get very weak and they actually atrophy and shrink.
So they actually get smaller in the layman's terms, and it actually sometimes they shut off even.
Sure.
We've seen that.
Yeah.
I've seen that where after surgery, especially after knee surgery.
It's amazing. You look at one leg compared to the other, and like this one wasn't eating. It just shrunk up.
So even knee arthritis, Brad, it tends to.
Well, that makes sense.
Yeah, to shrink down with the pain. So you've got to, the quadriceps, again, it's really actually 4 muscles, but you're strengthening it with one motion.
Right.
And so you got the vastus lateralis, vastus medius, vastus intermedius,
and the rectus.
Rectus femoris.
You can't forget the rectus.
So how do you do it without equipment and without increasing your pain?
Sure.
So what we're going to start you off is isometrically.
Sure.
Which is strengthen the muscle without moving the leg much. So most of you, almost really all of you, should be able to do this without increased pain.
This is a nice one for people with pain from arthritis because it's strengthening without irritating it with motion. So.
Right. So you're just going to need a roll towel. You might even be able to take a pillow and put it in half, fold it in half.
Yeah, like this maybe.
Right.
Yeah. They used to use coffee cans in the hospital.
Coffee cans.
But now they're plastic, so they crush.
Oh, do they?
That was back when they had,
metal ones.
Folgers would be that metal and whatever. That's another story.
All right, so you're gonna put it underneath the knee like this, and all you're gonna do is push down, and
do the other leg, Bob, so your stripe shows.
Sure.
Yeah.
There we go. And so I'm pushing down. So basically, I'm almost lifting up, but I'm
Yep.
pushing the knee down. And I'm going to hold it for, I'd say at least 5 seconds.
Yep.
Brad.
I would.
And you're going to do this times 30 times. And you only have to do it 3 times a week
Okay.
if you
So
want.
like Monday, Wednesday, Friday might be a
Right,
good.
right.
Yeah, not Monday, Tuesday, Wednesday.
Right.
You spread it out.
You want to spread it out. And the thing is, again, there's very little movement, so there should be little pain.
Hmm.
You don't have to do it that often, 3 times a week,
Right.
and you only have to do it 1 time a day. So, this is not asking much of you, but you can make a big difference if you start strengthening that quadricep. It can take some of the stress
Yep.
off the knee
Right.
with arthritis or whatever you have going on.
Right.
So now, as an alternative, let's say you're not an exercise person, but let's say you work at a desk. One thing that Mackenzie recommends is that every so often you just straighten the knee and tighten it.
Sure.
So, and
Mackenzie's a therapist as well, who's
renowned
Yeah,
therapist.
he's well known in the therapy
He's
world.
passed away, but anyway. So what you could do is just at your desk, go ahead and tighten 1, 2, 3, 4, 5. Now you could put it up on a stool. So
Sure.
if it's hurting to move it
Yep.
like this, but generally we like you to get some movement.
Right.
If there's no weight, so put it up here, squeeze 1, 2, 3, 4, 5. 1, 2, 3, 4, 5, and that way you can do your 30 that way too. If you want to do more, you want to do it every day.
Yeah.
That's fine. In fact, you want to do this a couple times a day. I have no trouble with that.
Right. Yeah.
So
it's not like you're really loading it down.
yeah. So eventually you could progress to maybe doing some partial squats or
Right. So that's a transition. Here we're working isolating just the quads.
Yeah.
But as a therapist, once you get better and the knee gets less painful, you want to transition that strengthening to weight bearing.
to a more functional
Right.
thing.
Right. So that's when, now the quads are working quite a bit, but also the hamstrings, the glutes, everything's kind of working together in a functional manner. And we've got different. Do we want to get into any of these or just stick to this?
I think this is enough, Brad.
Right,
But-
so,
but
yeah.
we got other videos on strengthening
Right.
for doing squats, and you can do air squats. You can do.
As a matter of
ball on
fact,
the wall.
we're going to make one today
Oh, cool.
using resistance bands.
All right,
but-
stay tuned. And remember,
Oh.
Brad and I can fix just about anything.
Except
A
for
broken heart.
right on, and the knees got nothing to do with the heart, I don't think.
We're certain of that.